Thank you very much. Honorable members, good morning everyone. I will remember the select committee on health technology. So the ayes have it. Thank you very much. Co-educators and the minister and team, you are invited here today for us to discuss on issues relating to the availability of drugs in public facilities. Before we start proper, therefore proceeding, my name is Honorable Muhammad, the chairperson of the committee.
Good morning. I am Honorable Akobadi Hart. I'm the vice chairperson of the select committee.
Good morning. I am Honorable One Bracket, also a member of Health Committee.
Good morning. You are a member of the committee.
Assalamu alaikum. My name is Dr. Yahya Mohammed Bah, subcommittee specialist.
Good morning. My name is Morris committee clerk and secretary.
I am Ahmadul Samati, Minnesota.
Yeah, Dr. secretary.
Good morning. Baban Salami, Department Secretary, Technical.
And Father Samate, Deputy Director, National Pharmaceutical Services.
Good morning, I'm Mohamed Kenya. I'm Acting Director of Health Services.
Good morning. My name is Alan Jade, the Procurement of Ministry of Health.
Good morning. My name is Bintu Chan, Health Communication Officer.
You know, I know you don't want to introduce yourself, but I know, Gambia today and the GTP and the National Assembly. We are streaming this live because this session is very important for people. So thank you very much, Honorable Minister and team. As I said earlier, you are invited here today to update the committee on the availability of public facilities. This meeting is as a result of a meeting we had previously, whereas we discussed the issues of drug importation and of course availability of drug in public facilities. And then later on, the National Assembly, or the Portfolio Committee here, we are confronted on many times about the availability of drugs in public facilities. And as a Portfolio Committee responsible for following oversight of the ministry, we deem it necessary as part of this scheduled oversight to invite you and your team so that we can hear firsthand information from you regarding the subject matter. We could have gone round, or even we have our own meeting to discuss this matter. I think as stakeholders, of course, as the people responsible for approving the budget as far as budgets of public facilities is concerned, it is incumbent upon us to hear from you as the implementers of this particular budget line, I can say, or this particular program. And then it is important that sometimes whatever that happens, we are seeing a lot of stories in the media, because we are all Gambians and we are representative of people. But before we even take a stand, or before we even have the authorities to discuss it as members, it's always important to give due to the stakeholders, to the Ministry of Health. We invite them, hear from them firsthand. They can tell us the processes that we are involved as far as is concerned, and where are we. And then we are also visiting facilities. I myself, I sometimes go and visit facilities. I know some of the conditions, I know some of the issues as far as the issue is concerned, but as far as I am concerned and as my role and responsibility is concerned, performing oversight and possible legislation and representation, I cannot make any concrete, let's say, concluding statement on this matter without hearing from them. So I am members, you are welcome once again. And this could have been an in-house meeting, but we believe it is important that we broadcast information of the general public. Because many times, even in social media, you will hear somebody stand and say, there are no drugs in the facilities. And as far as I know, for us, we've budgeted for that enough as far as the parliament is concerned. And there was enough money budgeted last year. It's never enough though, because even up to 50% of the needs for the drugs of the facilities. Because this is an issue that is ongoing. We have been informed several times. And then even the National Pharmaceutical Service one time appeared here, they presented to us the need, the drug need of the country. But the resources that they always allocate are not enough to buy all those things. But what we have is important. We tell the public this is what we have. So, honorable members, once again, thank you very much for coming and honoring this invitation. Today we don't have a full house because our members, some of them are on other committees, they are going to go and some travel. But as far as proceeding and procedures are concerned, we have a forum and we are able to proceed. So thank you very much, Honorable Minister. The floor is all yours and your team.
Thank you very much, Honorable Chair. Thank you very much, distinguished Honorable Chair and distinguished Honorable Assembly members. Thank you for giving us the opportunity to be here today to share with you the situation of supplies, drugs and other medical supplies in the country. And we are all aware the availability of drugs and other health consumables, medical consumables, is very critical to the success of any health system. All health systems require adequate amount of drugs and consumables. In the case of the Gambia, it is not different. What makes that of the Gambia different is 100% of the drugs and medical consumables used in our hospitals are imported. That makes it unique and different. Not a single item is manufactured in this country. And the items we need for the health sector goes beyond 500 individual items, and each of those has to be imported. But I must first of all thank you very much, the National Assembly and the government of the Gambia, the good work you've been doing together, because we must let the people of this country know, since the coming into office of His Excellency's administration working closely with you, what is budgeted for drugs and medical items in this country has increased fourfold. That is a big plus. It has increased fourfold or more than fourfold, and we thank you. However, as you are aware, each year there is a quantification process. The health workers, the hospitals, the regional directorates, and the central level officials and the National Pharmaceutical Services Department Directorate, they sit together and also inviting the experts to look at historical information of what was used the previous year, what the needs were, and using disease trends, they project the requirement for the subsequent year. So they call that process quantification. Now, after each quantification method, usually what the expected requirements are is listed. When that is listed, then we look at also the expected budgetary allocation for the year coming. Now, but at this juncture, it's important for us to note that usually, realistically, what we need as a country, according to the quantification, the funds that are budgeted, even though there is a huge increment, but it can cover only about 30% of the exact national requirement. So, yes, there are increments in the budgetary allocation, as I mentioned, fourfold, but even that fourfold is just 30% of what we would have needed to ensure that drugs are available 24/7, 7 days a week, and so on. This being said, the procurement process then starts. Distinguished honorable members, I think it's important for us to note that the procurement system of GPPA in as much as it is good to safeguard, to bring about accountability and transparency, but for the drug procurement, there are a lot of challenges. A lot of challenges. Now, the back and forth, the timeliness of quantification, preparation of bidding documents, sending the bidding documents to GPPA to get approval, bringing it back, contrast committee meetings, advertisement of these drugs, selection, evaluation of the submissions, and then selection, standstill period, contract signing, release of funds from Ministry of Finance, before these individuals could even be allowed to now submit those lists to the companies, manufacturing companies. It's estimated to take up to 6 months, this whole process. Now, if this takes 6 months of the year, if it is for 2024, for example, and then we need to procure for 2025. If we process in 2024, all these things take place. Now, but the budget, the allocation for 2024, 25 wouldn't have been out because it will start in January. So that means even if these things were allowed to go ahead in 2024 for 2025, then it's only in January 2025 they could be paid an advance payment. And now, for 2025. Now that advance payment now, it's most of them, it's after payment that they start counting the number of days they will take to supply. Quite a number say nothing less than 90 days. That's already 3 months. So you see that has gone up to March, April, for that particular year. So this procurement method is a big challenge. Now, if it were to, procurement were to start in 2025 itself, so you can imagine it will take towards the third quarter of 2025 for anybody to be able to get those supplies. This is one aspect. But I think beyond all that, the major problem we've been having is the unreliability of the supplies. When these tenders are floated, it is international competitive bidding. A lot of suppliers participate. Our team does the assessment, evaluation, and all. Winners are selected. For the past few years, those that won the biggest chunks of these drugs are Gambians. Well, Gambians who won, Gambian suppliers. But unfortunately, they have not been delivering on time. The previous supplier, 2-3 years ago, about 4 years ago probably, supplied some. That time, the issues we got were...
Sorry, please tell us what to...
The complaints we got were COVID-19 affected manufacturing because some of the factories had to close. Some of their people got sick. Then because of that, some of their people got sick. Because of that, the factories could not produce up to maximum level. Then we heard of the shortage of containers worldwide because of COVID-19 pandemic. Then they were also mentioning that shipping lines were not coming as they used to, and so on and so forth. But we realized that our suspicion was that probably the supplier, even though his documentation was all correct, but probably the supplier did not have the capacity. So when they don't have capacity, of course, when our team follows the GPPA rules, they qualify. But you realize that they wait for submission, they wait for allocation forms to be given to them, for them to be able to do. So suppliers who typically have capacity, those ones sometimes, they can even after signing the contract, they make their orders. And then those drugs could get here even before the payments. Of course, occasionally, there are payment delays also on the side of the government when we are supposed to pay. Occasionally that happens, but the majority of the problem is on the side of the suppliers. These current supplies that we are expecting for 2024. Now, a similar thing happened. Some of the suppliers did supply in time. In fact, when they got the contract, they supplied even before they got payment, they mobilized because they have capacity and they supply. Now, some of them, after winning, they withdrew. After winning, after going through the whole process. So when that happens now, then you are in a dilemma. You have gone through a process of almost 6 months. Now somebody won, only for the time for him to start mobilizing the supply. He said he has withdrawn. What do you do? Even if you take them to court, but that court process will not bring the drugs here immediately. So that is a big challenge for us. The other one is having capacity problems. But after winning the contract, now the suppliers come to say, or a supplier came to say he wants A, B, and C modified for him. So these are some of the problems, and of course we refused. One of those kind of things was everything had been itemized in the bidding documents, including registration of these drugs. And they said they are going to be able to do that. Only at the time of delivery, the contract was signed, I think, in November, end of November, early December. And then, well, I think it was December. And then the supply was within 3 months. That was supposed to be end of March 2024. And that supplier had the bulk of the drugs to supply. But just to tell you, the challenges we face. Initially, the supplier indicated that he wanted the registration requirement to be waived for him. He said, no, that was a bidding document. So it is like they win, and now after winning, they want to change the rules. Of course, we did not agree to that. Now, back and forth, and he said, well, MCA should help, ministry should pay for the registration fees to MCA, so that from the monies that the ministry is supposed to pay him. So that means him claiming to have capacity was not correct. Because if he had capacity, because this time around, so that government funds don't get locked to the suppliers, paying them and then government continues to follow them. The requirement was for them to pre-finance. They pre-finance, they buy, and when they supply, government pays them. So now that he's saying government should pay for the registration fees at MCA, that means that supply did not have capacity to do so. But in the process, they would have provided all the required documents. Now this went on, and we insisted no. Now apparently, later on we realized that some of the orders this supply did not even place with the manufacturers. When the ministry said, now bring the requirements, ministry could talk to MCA so that the process of registration gets expedited. The supplier did not provide dossiers of those items. He kept on saying, these were sent by DHL, and to the best of my knowledge, they have still not arrived by DHL. Now, suggestions were made to him. Why don't they get some of the items from the sub-region, where they could even bring them in trucks? Within a week or two, when the drugs are tested and packed in trucks, we could get these drugs here. They looked at that, which he bought into. They started the process, but even if that process was slow, there were times that he shared truckloads of cartons with my team, and those truckloads were not even true. Those items never came. That means they took truckloads that were not even meant for Gambia. So sometimes these are the serious challenges we have. Now, eventually, some drugs came from the sub-region using that method by the same supplier, but the delay had already been done. Distinguished honorable members, this has been a big challenge. So what really affects drug supplies in this country mainly is the procurement method and the unreliability of suppliers, most of whom are Gambians. This is our main problem. Now, as we speak, it's important to also say, in as much as there are challenges, in 2024, 45 containers, both 40 and 20 food containers arrived here by the seaport. Through the airport, 121 consignments came. Out of the, going back to the containers, out of the 45 containers, 40% were procured by Ministry of Health, and in some cases in collaboration with other partners. The airport, 121 consignments, 10% of which were procured by the ministry. And by road, 6 truckloads of medications and other items came. All these were procured by the Ministry of Health. This includes a lot of life-saving items. A lot of life-saving items are now present in the country. As we speak, looking at what is in our stores, that means what is available, up to 40% of the essential medicines are available and are in stock. So this is very important. But to complement all this, honorable members, it's important for us to also remember this is separate from the drugs that hospitals are able to buy on their own. These hospitals have internally generated revenue using the drug revolving fund mechanism, and these funds are majorly to be used to procure medicines and medical consumables. So that complements this. So in the hospitals, we expect more than the 40% of drugs to be available. And I can attest to that myself. I have been going around the hospitals, and each time I enter their hospital stores, I see, in fact, drugs in all the groups in all the treatment groups, treatment categories. In the hypertensives, antihypertensives, you see the drugs. Antibiotics, both oral and IV, you see them. And the diabetic drugs, you see them. And so on and so forth. So for each category, drugs are available. Of course, we do not have all the drugs for a particular category. And it's important, as we made clear to Edward Francis last week Wednesday when we went on rounds, that it's important for the hospitals also to provide weekly drug bulletins. The weekly drug bulletins help the prescribers, the doctors and the nurses to know which drugs are available. An example is, if people want to prescribe ibuprofen, and they keep on prescribing ibuprofen, and then they keep on getting not available. Maybe the stock level of diclofenac is high there. But if the prescriber's prescription tendencies is towards prescription tendencies are towards the prescribing of ibuprofen, the diclofenac will stay there until it expires. But maybe they didn't know, and maybe that prescriber really wouldn't have minded whether the patient gets diclofenac or ibuprofen. Probably that prescriber is only interested in the patient getting a non-steroidal anti-inflammatory drug, and then diclofenac would have gone. But he didn't know that you have a lot of diclofenac in the hospital. So that's why we say the hospital teams must make sure they provide regular drug bulletins to the prescribers. When we go to the smaller health facilities, they have also, as we know, traditionally been getting the results-based financing model contributions, whereby World Bank and Gambia government have partnered to provide additional support. And as we all remember, that support, 40% was meant for staff bonuses, and 60% was supposed to be spent on the facility for maintenance and for procurement of drugs and essential commodities. And this also is additional financing for procurement of drugs that is different from the central supplies. So if this is managed well, that means it will close the gap. Now, yes, RBF has been transformed, so to say now. We're not getting the RBF now, but it is being replaced. It is being replaced by the National Health Insurance Scheme. And the National Health Insurance Scheme is operating in a similar way, whereby facilities carry out functions, they issue out drugs, and then they send those their requests to the National Health Insurance Scheme that reimburses them for that, and then they get additional funds to procure drugs and to use for other services. And as I speak to you, distinguished members, many of these facilities, those are in the pilot form. I think about 12, 13 of them, between 13 of them have received such payments. And some have already bought some items from it, some drugs, and some are in the process of procuring some of these drugs, including Brikama that I visited. Brikama Islands received, or is supposed to receive, over 1 million dialysis, from the health insurance. And other health facilities have even received more than that. So this is actually supposed to be used to buy medicines and laboratory items for some of these facilities. Honorable members, we also have a long list of the items that are available and we'll share with you. But at this juncture, I would stop at this point. If you have specific questions, we could go ahead to answer those. And my team is also available to contribute to the submission that I've given. Thank you very much.
Yeah, thank you very much, honorable members. I think that was a very, very good presentation as far as the purpose of the meeting is concerned. But still, if any of your team want to say any more, you are welcome before we come in. Questions and comments.
Any comments, additions?
Especially from the National Pharmaceutical Service.
Not at this point.
Okay. Okay. Thank you very much. Then I think we can move on to the other segments. Also, honorable members, I think we had what he presented here. Of course, he talked a lot about the processes involved and some of the challenges they've highlighted, and they will share the communications, this presentation with us, so that we can include these things in our minutes. I understand no sufficient funds, so I think that is a point for us to note that whenever we budget, it can only cover, despite the increase, only 30% of the needs. I think it's something which you know that we should take note of as a parliament. GBPA procurement, I know that that's going to generate a lot of questions and of course comments. And reliability of supplies, that's where I know the issues are definitely more centered on, because you prioritize, they are all Gambian supplies as we said, and at the end of the day, they are not able to deliver. And we hear people talking, medicines are not available, drugs are not available, and so on. while the portfolio ministry and of course the government of the Gambia have done all the necessary things as far as the allocation is concerned to follow the rules and then the procedure and the processes to make sure that they get supplied, but at the end of the day, the supplies are reliable. Of course, we highlighted some challenges in the importation process, registration, which you know that you cannot wait as far as those are concerned, unavailability of containers at one point, shipping line issues and so on, due to some global conflicts here and there, which we are all aware. So these are some of the issues that he highlighted and many more. So the floor is open for honorable members. If you have any further questions, comments, you are welcome. I will advise and then from Bala. So the floor is open.
Go ahead.
Yes, thank you very much. Well, I have few concerns. One of the issues is the issue of the GPPA. We would want to know what are the challenges that is hindering the process so that we can also challenge it with GPPA. Understanding this progress, with your team, what suggestion do you have as a solution mechanism to make sure that these things is not happening? I remember years ago, then the Gambia government signed a contract with one company in Egypt, and they were supplying 5 years, if I may right. And you can see this issue of procurement and whatsoever was addressed, and the trust was there. At the time, that company would even suggest in giving drugs, although I think it was detrimental to the CMS, but there was a system that allowed that uninterrupted processes. With you and your team, do you have a solution that will remedy this current situation? Because if I read it right, meaning that the assumption that people are saying that the inavailability of drugs, and now in your testimony, it's like 30% available, if I'm right, meaning that less than half of the expected drugs that should be available in the public services is not, if I'm right, and I want to be corrected.
Yeah,
that's the question.
Yeah, the Honorable Minister, I think, and your team, I think you've taken note of the question. But before if you come in to answer the question, you said 30% of what is budgeted, what is budgeted for as Parliament can only cater for 30% of the needs as far as their quantification is concerned. And when we came to Parliament in 2017, these are the issues that we are celebrating, that the previous regime were doing single sourcing for medicine. This I can fully remember. And when we came in, they said now it's international bidding. We are all celebrating. In your, these are some of the challenges. But this is just, as far as I was here, and I'm still here, I can share this thing. So, Honourable Minister.
Yes, thank you very much. I'm happy you bring in that point, which is very important. So, going by the percentage, we are talking about what is quantified nationally and what is available. And what funds are made available. But the current availability of essential drugs, because we have a national essential medicines list, and then what is in the CMS now, up to 40% is available, 40. But this is different from what the hospitals buy for themselves, because hospitals have income. So if you put together what the hospitals buy, it could go to up to 60% in the hospital. So that's why when you go to, or even more, because I was saying earlier, when we enter some of the stores, because when I go to visit the hospitals, I enter the stores and I check what is there, and even what is on the dispensing table. You see, all the disease groups, virtually those that are dispensed or over the counter, they have some drugs belonging to some of those groups. For example, antihypertensives, you will have them. Anti-diabetics, you will have them. Antibiotics, you will have them. Of course, you will not have all the antihypertensives in the world or on the essential medicines list. But you'll have those that the patient can do with most of the time. So this is what we say, and we are encouraging the hospitals to produce regular drug bulletins so that the prescribers know what is available. Because if they prescribe and put a particular name sometimes or particular thing, If you take it to the pharmacies, as you know very well, if it is not there, that one that the prescriber said, they will get NA. That means not available. But meanwhile, as a particular drug is there in the same group, that will also suffice. And they didn't know that that was there. So we said they need to communicate more. Okay. I'll also go to, and sometimes the improvements at the point of care. I'll give you one example. I went to Brikama Health Center. I went through the whole store. I mastered everything in the store. Then I came out to the dispensary. I stood there and I asked the dispenser, yes, what drugs do you have? She was happy because she was able to dispense. And I mentioned, what about this drug? Do you have? He said, yes. What about that drug? No, we don't have. I said, no. I just saw it in the store now. So you see that communication. Then they looked around, her supervisor said, no, but we have it. She looked around, it's standing there. So if patients have been coming and that drug, she would have been saying to them, not available. So that oversight we need to strengthen and teach our people to know what is there and so on and so forth. And also, sometimes we also have people, sadly, who do not pay much attention to detail, and it's easier for them to say to patient not available without checking. That is in the minority, but occasionally we get those reports. Coming down to the procurement method, yes. So these have been the challenges of the international competitive bidding, especially doing it annually, every year. The annual one is a problem. So this is the request we have for you, honorable members, to help us to do it for a longer time. Probably 3 years or 5 years if they are good, but at least 3 years. So that when we know that there is a contract between these people and government and they continue to supply. The process itself of selecting those people should be competitive. That's one. The competition is important. It's good. It brings about transparency, accountability, and value for money. So, but for a longer duration. The one that used to be there previously has its advantages and disadvantages. The disadvantage, because I also tried to find out, the disadvantage that I was told, when you compare it with the international competitive bidding, the prices in the international competitive bidding were much lower than what those people who had that supply contract were offering. So it was more savings for government and the people of this country. So, but if we go into such, the process of recruiting the particular supplier should be competitive. And then the duration could be longer. These are the kind of things on our minds.
Can I just interject? Now, between these two processes,
yes.
For us as representatives of the people, what you want to see is drugs in the facilities.
Yes.
Between these two processes, which one you think is positive as far as availability at the local level is concerned?
Which one?
Between the international competitive bidding and the single sourcing.
So the international competitive bidding could have a clause, the duration of the supply could be longer. If we have international competitive bidding with longer supply period contract, I think it's better than the international competitive bidding with just 1 year contract. And then I think it's also going to be better than single sourcing for a longer period.
Yeah, thank you. It's a similar point, really, just to elaborate a little bit more. With the previous system that we had in place, also the product range was quite limited. Now that we have gone international, we have been able to procure a variety. For example, in each category where we were limited to 1 or 2 drugs, we can now get a variety in that particular category. We know that medicine is advancing every time. We don't want to get stuck with the same drugs. So as medicine is moving, we have been able to produce a wider range of products, or procure a wider range of products for the people. So what Honorable is saying is like a compromise, I would say. There's a process called supplier pre-qualification. It's a rigorous process, but I think at this point we've dealt with enough suppliers to know who are reliable, to know who bring about the quality products. Of course, it doesn't bypass the GPPA or the Medicines Control Agency systems. These pre-qualified suppliers would still have to follow all of those rules. But what it means is that you have a kind of a framework agreement with certain suppliers who follow the rules in terms of delivery, in terms of quality, in terms of every other thing that there is, transparency and everything. But at least you are assured that these suppliers I'm dealing with year in, year out, and they're going to deliver as required, they're going to deliver the quality products. And in some cases, even if the payments are delayed, there's that understanding where they continue to produce, to bring in the supplies. So I think the system that probably we ought to push for is that kind of hybrid. Yes.
Yeah, thank you very much. I think positive from what the Honourable Minister just submitted, and of course, as you elaborated, I think we will take note. I think, Honourable Members, we need to engage the GPPA and then see where we are, because I think it is important that it be competitive. But like he said, every year doing the same thing, same process, it's something that is causing delay. Like if I understand what the Minister said, what was meant for 2024 will go to 2025. What was meant for 2023 will come to 2024. So the cycle keeps going, and then the challenges still continue to be there. So I think that's something that can be done. It is us who make the laws. If there is any recommendation, also ask for some of these procurement laws, please recommend to us. We don't mind coming up with a committee bill and changing it to make sure that the people have what is best for them, and then what is make sure availability is not also compromised.
So, I was thinking, I just wanted Mr. Savali to update us on, because the 2024 procurement had not been completed, and that process is on, but they have gotten some new people who have started supplying. So you want to give us an update on that?
Yeah, thank you. Yeah. Thank you, Honourable Minister. Before I give an update, I just want to elaborate a little bit on the international competitive bidding and single sourcing. As you rightly said, it has been single sourcing for quite a long time between the then government and then a supplier in Egypt. But after the change of government, we realized that this is not creating value for money. In a simple state interpretation, when you are getting 1 tin of amoxicillin from that Egyptian supply, you can get 3 tins of amoxicillin from international competitive bidding. So that's create more wealth for us and give value for money for us. So that's why we departed from that arrangement to international competitive bidding. And I think we need to stick to that. Yes, several attempts have been made to do a framework arrangement. However, if a supplier didn't perform, you cannot continue framework arrangement. You have to call it off. And that has been also a challenge. But as alluded to by Fatu, I think pre-qualification of suppliers is one way that we can embark on. So far so good. We have done some requests for quotation. After we realized that the suppliers for 2023-2024 contracts were not performing optimally as we requested, as required. 2 of them withdrew. One that has the chunk of the item, over 190-something items, can only deliver 20 items as of now. So we decided to have a quick fix, and that we ran a RFQ. And then we've contracted about 4 suppliers. These are international suppliers. And then so some of them have started delivering as of now. One of them is MPP. They have about 15 items. And then we've received 5 of those items last week. These are safeguard measures. And again, we contracted another suppliers called Angel Pharmaceuticals. They have given 17 items. And out of that, we received a notification this morning that 10 of those items are on their way coming, and these are coming by air. We also contracted Multi-G. They performed in the last contract, and then we extended some of the items that they won to them. They had about a total of 11 items, and we also received notification that the shipments are ready, and in the next 3 weeks they'll be delivered in the country. The fourth one is the Entrance Pharmaceuticals, Wigag in Ghana. These items are coming by land, and hopefully once the manufacturing is completed, the shipment will take by land will take only 7 days or so. So these are just short-gap measures to ensure that we address some of the urgent life-saving items. Additionally, Ministry of Health engaged the third-party supplier, UNOPS. This is the United Nations body, agency that also are into procurement. We contracted about 60 plus items to them. All this, as I said, is it's a short-gap measure to ensure that we address these shortages of medicines in our health facilities. And then UNOPS, as you rightly know, it's an agency that deals with high-quality items, and they have their network all over the world. And we are sure that in the next couple of weeks or so, they will start delivering some of these items. So far, these are the measures the ministry have taken to mitigate the supply failure. Thank you.
Thank you very much. I think that was very good. Very good.
So, Honorable Chair and distinguished honorable members, so that means, what that means, maybe we can get this. What that typically means is that in the next 2 to 3 months, when all this come, there will be a big relief with regards to drug challenges we've been experiencing. Because this will all come to add on to what we currently have. Of course, what we have, some will be consumed, but some will be left, and then they are bringing in more. So this will be a big relief. Now, of course, some of these are remnants of the 2024 procurement. But they are coming to be used, and they will go on for most of 2024-5. Then thereafter, the supplies of 2025 will start coming in. So this process of coming to start the 2025 procurement is where we need all of you to support, so that we can have a smooth supply chain mechanism, system for drugs. Thank you.
Thank you. Yes, Chair. Thank you very much, Honorable Minister. I will start by saying thank you for the compliments in terms of the Assembly stance in improving the figures when it comes to budget allocation as far as drugs are concerned in this country. We believe it is very important, and as people that are also very concerned about the issue of health in the Gambia, it is indeed our responsibility to do the needful. It is indeed also a very big surprise on our side to realize that with all the budget allocation that we are given, we are only achieving 30% of the total budget need for drugs in this country, which is indeed something that we need to work on as Parliament, and also with you, your ministry, to see how best we can improve the figures, because it is indeed very important. 30% is indeed at a very low side. Even though you've given us other information concerning the current 40% in all the public hospitals in terms of availability of drugs, apart from what the hospitals normally buy and also supply to the patient. But I think it is indeed very, very important for us to improve on that. That is one key thing that I've learned from your submission. The other thing has to do with the procurement, as mentioned by my honorable colleagues. I think as a country, as far as we keep on managing problems, we will never solve them. Because what you have said here today, to be honest, personally, and I believe if I am to share it with my people at the end of the day, it is something that is unacceptable. Because you cannot go in for a bidding, and you've been awarded the contract, you accepted the contract, at the end of the day you decided not to go ahead and instead at the 11th hour withdraw, which is also leading to a lot of problems as far as the current situation is concerned, because you go to hospitals, we go to hospitals, and you will be in a situation whereby whatever you need, they will always tell you go outside and buy from the pharmacies. And this is the reality that is happening. It just happened to me just 2 weeks ago at the Edward Francis Small Teaching Hospital. Most of the drugs that we're supposed to get for the patient that we took over there, they asked us to go outside and buy. But at the end of the day, what is happening is not like there is lack of funds to procure, but delay of procurement. That is what we are hearing from you, which is indeed something that we cannot just accept from, especially suppliers. So as far as we are concerned, like the saying goes, a problem that is not solved is still a problem, but a problem that is solved is no more a problem. So what we can do together with you and your team is to make sure that we strengthen the issue of procurement and also engage the relevant authorities, especially the GPPA, in terms of expediting the situation when it comes to drug procurement in this country. This is something that I believe it can go through the normal process, but not that normal process whereby you have to delay each and every step that has to be applied as far as the process is concerned. Because we're talking about the lives of the Gambian people. Because we need drugs in order to survive. And most of the things that we are faced with right now as a country, even though we are trying in terms of the health sector, because the issue of misconception is all over. Because one individual will go to a hospital and they will be told that there is no drug. But there is no drug doesn't mean that there is no drug at all. Maybe that particular drug that they're supposed to give you is not available. And now you are affirming to us that it is not available because of delay of procurement and also the process that is that we put in place in terms of procuring the drugs, which is indeed very important. So what we have to do is to improve on that. And if that is solved, you are also giving us assurance that this year, before July, possibly, will be relieved as far as the recent supply that we are receiving from suppliers. But that also, we must also come up with a more robust and proper mechanism, avoiding situations like this to happen. Because the issue of drug is very fundamental and is very key as far as the Ministry of Health is concerned. Everything can happen, because today, all what we talk about is like, we have the structures, the existing structures. And we have seen the recent development that is happening at the Edward Francis Small Teaching Hospital. We are very happy with the situation there. But at the end of the day, with that existing structure and without the availability of drugs, it's meaningless. But what can we do to improve and change that entire situation? That is why we are here today, to make sure that we have not even a temporary solution, but a permanent solution. And I believe we can. Because if we can already identify the status quo in terms of the availability of drugs in our public health facilities, then we can improve on it. And we can only do that by making sure that we regulate and make sure that whatever we do in terms of procurement is being done properly, and we do it with caution and make sure that we do it with immediate cost. It doesn't have to be spending time on it. As far as it is drug procurement, it has to be expedited so that we can get access to whatever supply we have to get, and also get involved or deal with serious suppliers. People that have the capacity in terms of supplying drugs, as far as the supply of drugs are concerned, and not anybody. So this is what I want to say, and I think it is important to have this meeting, because at the end of the day, the public need to know. As people representative, I believe the public need to know. Because to be honest, there are a lot of misconceptions out there. And these are some of the realities that we all face with in the hospitals, especially with in our public hospitals. We go sometimes, the particular drugs that we need, they will tell you there is no drug. Just go outside and get it from private pharmacies. And I believe we need to, and we can improve on this. Thank you.
Thank you very much. Thank you very much. I like the proverb that you keep saying, a problem that is not solved is still a problem. And I believe we are also part of the problem as parliament. We are part of the equation. I think you can do something that makes a list of the problem. So honestly, thank you very much. I think that was a good submission.
Yeah.
This also, yes, you want to comment?
Yes, I just want to go back to...
You are cutting my comment.
Oh, sorry.
No, but you can carry on. I can reserve my comment.
Yes, I want to go back to Madam Samate. You see, I'm lost. We want a solution. If international bidding is the gateway, that will be the solution. And then we are thinking also the government of the Gambia having a partnership with a reliable company that will be able to, at least without the delay process of budgetary allocation, that trust have already established between the government and that area to avert this kind of delay. In your contribution, does that exactly mean the international bidding where my boss also talked about some of the value for money? I definitely want to know that, because we want to look at a solution, to look at these processes are not. Because I went to, made an investigation to find out why this delay. One of the guys that was so said, the procurement rule was not favorable, because they said you cannot be given money, it's 100% delivery, 100% payment. Along the road, financial they were blocked. So meaning, the procurement rules applied to those people, even they are ready and committed, was not favorable to them. So now, and I'm suggesting now, if we are to go into a long-term partnership, that will bring in trust. Even there is a delay of budget coming, but these people can sit stop. I want you to explain what exactly you mean, how can we do it? Because when you talk about international bidding, and then this guy also come and talk about the rationality of getting one customer, for example, one team in value for money, that is what I want to know, because that is the solution that can help this government and the people of the Gambia.
Okay. Yeah, thank you very much. Before you come, I just want to make maybe 2 comments. We are informed, even during the budget process, the budget line for drugs by the Ministry of Finance, that money is, once health request is always available. That's what finance told us. That's what she said. So the other thing is, like the minister also said here, pre-financing. The contract term is pre-financing. So I don't understand whereas you agree on a pre-financing term with a supplier. Later on he'll tell you, I need money. Pre-financing, you don't need money. As far as I mean, with my little financial knowledge. If you said you are going to pre-finance this, I'm going to pre-finance to buy water and supply you, then let I pay you. I think that's why you did not give me money unless and until I supply. Yes, madam, now you can respond, please. Can you write mine?
All right, thank you. With regards to the procurement clause, the clause that was inserted in the documents to say that you had to deliver fully, you may or may not be aware that in the past we have had situations where we've paid suppliers and they failed to deliver. Going to 2-3 years, they have failed to deliver their products. And what that means is that funds are already committed to that particular supplier. So it gave us no liberty to, for example, conduct an RFQ with different suppliers, because those funds were already given to this supplier who failed to deliver. So we wanted to avoid that. That's why we were like, you have to prove, in any business, you have to prove that you have the capacity to deliver. Whether or not you are paid upfront, you have to be able to deliver. So that's why that clause was inserted. And surely enough, if it wasn't inserted today, it wouldn't have given us the chance to now say, okay, since you can't deliver, we can now use those funds to give it to another supplier that can deliver. So that is that. But just as Honorable had alluded to, this pre-qualifying process would still be international. It would be very open, very competitive, very kind of thorough. So it would be open to suppliers to say this is the arrangement that MOH would like to have with suppliers, with requirements put in place. So these suppliers would have to be vetted based on experience, based on capacity, based on various other things. So that process would be open. Now when you have gone through the process, you selected 4, 5, or however many, that qualify according to our requirements to say now we're going into a framework with these 5 suppliers so that these suppliers would be supplying us. It might be that one supplier supplies 3 drugs, another supplier, however many. You go into an arrangement with those suppliers to say for the next 5 years they will be supplying you with these drugs. I mentioned about the payment challenges because we know that sometimes from the government point of view, payments can be delayed. But when you have that trust with them and they know they're contracted with you for the next 5 years to supply you, they might say, okay, we were expecting to receive this payment in December. We haven't received it, but for the continuity of supplies and continuity of services, we are in a contract with you, so we know you're going to pay us. They might still supply you with what you need to kind of plug in those gaps. So that is it.
That was I can see that. But I just have this question. Back our last tour, when we went to NSPS, it was part of our recommendation that probably you move from, you be semi-autonomous sort of. Is the ministry thinking in that direction so that they can have the authority to procure drugs directly by themselves and they supply the ministry?
Yeah. So thank you very much, Honorable Chair. So that is the new way of thinking, as other countries are doing it, to have semi-autonomous central medical stores. That is even out of the National Pharmaceutical Services. We'll come to you for the support. We're looking at developing a cabinet paper for that, and then eventually the legislative bit, we will ask you to support us. But we have seen models in other countries, including Rwanda. This entity, what they do, they procure the drugs. They would have been given some leverage, some provisions. They have their own resources. They look at, manage their stock levels, and they buy drugs and stock. The advantage of this is because even with the National Health Insurance Scheme, our current modality of procuring drugs is not tenable. Because if at the level of the Ministry of Health drugs are procured, they are supplied to Edward Francis Multi Hospital, Bantam General Hospital. Now, when these are they are recruited in the National Health Insurance Scheme, they provide services, they provide the drugs, and the insurance pays these hospitals for the services and the drugs. So, and then those drugs would have been supplied by the ministry. So now, with the new arrangement, if the CMS is to be semi-autonomous, they will now buy all their requirements directly from the CMS. This will remove procurement issues from the Ministry of Health for drugs, and I believe that is the best. It has been one of the most difficult things for some of us. Because of the unreliability of suppliers, it's a nightmare situation, believe me. I wish for a situation whereby we deal with clinical issues and then supply of drugs is taken care of by another entity. When our hospitals need drugs, those drugs are brought to us and we do the work. But sometimes life is not what you wish, it's what you have. But with the coming into the being of, inshallah, the new modified central medical stores, autonomous, Edward Francis will look at their need, buy from them. Dispensary people, National Health Insurance reimburses Edward Francis. They look at their need, go and buy, and more. And then and the good thing about that situation is even private hospitals can buy from CMS then, directly. And they will be at least operating above margin to prepare for inflation and operational cost. All the pharmacies in the country could equally buy from CMS to stock their pharmacy. So it is a wonderful thing, and I think that eventually is what we want to advocate for, so that we can focus on managing the hospitals and clinical services rather than on procurement issues. Yeah. So this is what is happening. The pre-qualification is a procurement method. It's like a screening method. Sometimes, even with very big procurement, they want to look at the really serious potential participants. So sometimes they do that. It is an acceptable method to look at those who have the capacity. The capacity is the problem, just like the Honorable Chair has said. These people would have claimed they have capacity to pre-finance. because they provide documentation. But at the end of the day, when it comes to delivery, they are unable to. But the thing is that, of course, we are all appreciative of the fact that we are in a democracy. If they don't supply, what next do you do? Then you start following the rules. We reported these issues to the Ministry of Justice, like this current supplier, for legal advice. Because at the back of our mind, we thought we should take legal action because, they delayed the supply and they agreed to that. They signed to it. But the problem is, and those that got it and withdrew, what do you do with them? But whatever actions we take against them, our drugs are late. That is the painful part. They participate, they make supplies late. Even if we follow legal action against them, then that doesn't bring the drugs today that we need it. So this is a very difficult thing. But we believe GPPA could also help us to apply very strong actions against these people who do not participate. Our team has been reporting their issues to GPPA so that any future procurement in the country can be sanctioned. Thank you. Yes, I don't know if we want to say something on administration.
Before you come, I just have a follow-up.
Yes.
I stepped out. I don't know whether part of your challenges you mentioned about issues that you face with MCA, because I believe all drugs that are coming also must go through the regulations as far as MCA is concerned. Is there any challenge, I want to know, that you face with MCA?
So typically, for example, the current ones that MCA insists on them being registered. So that registration could be a challenge. But I think the truth of the matter is, the registration is important. The fact that it is important, what we say to people is that, why don't they do it in time? If something will take 3 months, why don't they do it 5 months before? Then even before the 3 months it would have come. But they wait until 1 to 2 months before the deadline. They want to start. This is the problem in many of our systems. So typically we think if the participants are serious participants and they do it in a timely fashion, the MCA issues will not be a problem. Because it's very important that we ensure quality and then we ensure that the drugs are safe.
Thank you. In depth before. Minister, how would you react to this? This is a poor country. This country have been benefiting from donation like the Anita Summit.